Good afternoon, everyone. My name is Kristin Maun, and I am the Director of Housing Development and Incentives for the Tulsa Authority for Economic Opportunity, or TAEO. We are the public trust authority that serves as the lead entity for the City of Tulsa in carrying out community and economic development. Thank you for joining us today for a presentation on the Tulsa Health Department's Safe and Healthy Homes program. Before we begin today's presentation, I want to share with you two opportunities for landlords and property managers in the City of Tulsa. First is the Abode Initiative, which provides information to landlords and property managers about resources and opportunities in the City of Tulsa, such as this webinar. You can receive regular email updates and also reach out to the City and TAEO with questions or concerns that you may have. There is no cost to participating. Just email me at kmaun@cityoftulsa.org. The second is the Gold Star Landlord Program, a free and voluntary program that provides rewards and incentives for landlords and property managers who engage in the best rental practices. Our incentives include advertising and promotion as a Gold Star landlord and incentives funded by the Affordable Housing Trust Fund, such as landlord guarantee funds available from the Tulsa Day Center, Housing Solutions, Tulsa Cares, and Divis. For more information on the Gold Star Landlord Program, you can join us for a free webinar on Wednesday, March 30th at 12 p.m. or email goldstar@cityoftulsa.org. Today's presentation is on the Tulsa Health Department's Safe and Healthy Homes program. There will be an opportunity for questions. Please put your questions in the Q&A section. This presentation is also being recorded and will be made available for sharing online. Thank you, and I will now turn it over to Kendra and Felix.
Thank you, Kristin. Thank you very much for having us. We're going to get started today. Felix is going to let you know about our Safe and Healthy Homes program. He is going to be your primary contact for that. And then he is going to hand it over to me, and I am going to talk about one of our biggest incentives, which is the LED program. All right, Felix.
Okay. Good morning, everyone. I'm going to go ahead and share my screen really quick. Okay, I'm Felix Ngouan. I'm one of the environmental health specialists here at the Tulsa Health Department. And as Kendra mentioned, I'll be your point of contact when it comes down to enrollment into our Safe and Healthy Home program, and as well as providing you any information that you need. So on this slide, you can see some of our vision, mission, values here at THD. And we're trying to make Tulsa County the healthiest county in the country. By doing so, trying to improve the health and well-being of all residents. And again, if you guys have questions, you can feel free to post it in the Q&A, and I will answer them whenever time comes. So here you can see that we listed some of the hazards that can cause health issues, and during our inspection, we help identify them and work with you guys to address some of the issues. And most of them have serious health issues, and such as we have asthma, allergies, some behavior and learning problems, lung cancer, poisoning, and high blood lead level. So the Safe and Healthy Home definitely will help, address some of the issues, or identify them, and also help, address them. So regarding our program, it is free, okay? We don't charge you guys. You call me, we'll set a time, we'll talk about it, but we focus on educating both landlord, renters, on the importance of a safe and healthy home. We train landlord, property managers, staff to use the renter walkthrough inspection form. I mean, we provide forms to you guys that you can use to do your walkthroughs. We do require owners to give renters information on their rights and responsibilities. So it's very important to provide that to them as well. And we do conduct courtesy inspection. So whenever you guys call me, we set up a time, we go over the program, I explain to you how it works, and then we'll do inspect your vacant unit if you do have some available. Now, in some cases, it happens that some of the properties you guys don't have any vacant. Most of the time, we rely on you guys to do a walkthrough with the tenant, and then if you can forward that to us, so we can see that, we can verify that you guys actually taking step to provide a safe environment for tenant. So why was it important to create this program? As you can see on this slide, the high eviction rate and lack of affordable housing play a key factor. And also we receive a lot of complaint, from tenant. So we're trying to be more proactive instead of being reactive. So instead of waiting for tons of complaint to come to us, we're trying to figure out what would be the best way to kind of, reduce that number. So I truly believe that, partnership between the Tulsa Health Department and, landlord owners, property managers to kind of, address those complaints before, it actually occur. So through technically, when we do our inspection, we can identify some of the issues, and then we can let you guys know, hey, I think you guys should address this issue. And if it requires time, we'll work with you guys. Again, it's a courtesy inspection. It's not anything that is gonna, count against you. We're gonna work with you guys. We're gonna be a resource to you all regarding any issue that we see. And as I mentioned, our housing inspection here that we do have our complaint based, and which make the progress very slow. So until we get complaint, we don't know what's going on, okay? And it's very difficult to reach some of the renters, and most of them are not really reporting issues or complaint, in a timely manner. Sometimes we'll hear about issues way, after it happens. So the process of our program, how does it work? And I believe most of you guys, some of you guys are going to be part of the Gold Star program. So one of the requirements, I believe, for the Gold Star program is for you guys to be part of our program. So you're going to call me. I'm going to set a time. We can meet via Zoom. I can send you email. We can talk over the phone where we talk about our program. And if you have any question, you can ask me a question at that time. We'll discuss the walkthrough inspection form and the frequency. And I'm going to provide you guys a packet, and that packet kind of also provide additional information regarding our program. There's a consent form, and there's a registration, property registration form that I will need back from you guys. So the special form is very specific to our program. And again, during our meeting, I'm going to go over that. And the whole goal is to make sure that we provide a safe, and healthy environment to our tenant. Now, once you enroll, I'm going to deliver the form to you, and then you're going to receive some decals, certificate of participation. Now, probably some of you guys have Section 8, and in case you don't have any vacant unit for us to be able to inspect, we're going to also we're going to ask that you do provide copies of your most recent, Section 8 inspection done. So that way we can see that at least you get inspected, and you maintaining, your property safe for tenant. So some of the incentive that we have for you guys, honestly, my goal is to minimize the number of complaints. Okay, so if we can address that without having to write, notice of violations and create big headaches, that would be a good one. So usually when we receive complaint, I reach out to my coworkers to see, if the complaint that they receive is for one of my safe and healthy home landlord. So if it is, I'm gonna get hold of you guys and I'm gonna be like, hey, I got this complaint from for one of your properties, and we're gonna try to work together to address the issue. We do have a LED program that Kendra is gonna go over. And again, be part of our program, you definitely qualify to apply for that. And Kendra is gonna go over that with you guys in a little bit. And another benefit is we do mosquito surveys and we set up traps during mosquito season. So if you're interested, if you have very bad mosquitoes in your area, I mean, definitely we can come and do a survey. We can set up traps and help, reduce, the number of mosquitoes by spraying. We do also offer, rodent survey, bait station as well. So that's another benefit you have. Education opportunity for staff. So if you have property managers, maintenance staff, I mean, if you need us to come and, provide, and educate them about their roles, I mean, we will be glad to do that as well. So again, we're trying to reduce the number of disputes between, tenant with landlord by being proactive. So benefit to you, I mean, great PR. You're gonna be on our website. People are gonna know that your place is safe for tenant, to rent. And then it's gonna also help, help reduce vacancies. More people are gonna apply, try to get into your properties and reduce turnovers as well. And by doing so, we're gonna reduce, hopefully, the number of eviction. And through our education of the tenant, we're gonna have better renters. This one is just our renter walkthrough inspection form that we provide to you guys. I know most of you guys probably already have an inspection form, but you can use ours or you can use yours. Either way, as long as we're sure that you guys are doing, the walkthroughs with the tenant to make sure that everything is good before we're moving. And these posters are provided to you guys as well during our meeting, kind of tell you how to be key to safe and healthy housing. Again, I mean, it was pretty simple. If you have any question for me, this is the time to ask. And this is our contact information. You can reach out to me. My email is actually is fngouan@tulsa-health.org, or you can email Kendra as well. Okay, question time.
I don't see any questions in the chat box, but I am just going to throw in a couple of additional comments. Sorry, Felix, when I made up the PowerPoint, I did not do your email address right. Okay, so a couple of things we really want to stress, you all. First, Felix, you did a great job, but you know me. I just like to say a lot of stuff. The Safe and Healthy Homes is an education program, not a compliance program. So, Felix was explaining kind of the two ways that we do inspections. And so we have, since the 1950s, had a compliance program. And when he was talking about the progress being slow, I mean, we're all driving around looking at these houses that just really look terrible. And as people that are investing in neighborhoods and wanting your property values to increase, you have neighbors that are living in these houses that just really don't look that great, right? And I'm concerned about the people living in the home and their public health and the stress and the tax it puts on their life. And other people might be worried more about the economics. So we're just trying to put those two together and come up with a program. So we are focusing on education. If tenants call us, we understand that there are two sides to every story. In the past, we have not had any way to get a hold of an owner of a property or a landlord or a property manager because we have no way of collecting phone numbers for all the different businesses in town that rent properties. So this is a way for us to, if we get a complaint, contact you and see, like, do you even know that this is happening in your home? Because we know sometimes tenants call us and they might have alternative reasons for calling us and creating issues and problems. And you might not even know. We know that there's a landlord-tenant act and you have a chance to correct the problem. That's what we're trying to do, kind of work a different angle so that we can all work together to improve the housing in Tulsa County. Let's see, we have 2 opportunities for you to train your staff coming up in the month of April. We have Housing 101 on April 7th. It's going to be virtual again this year. Unfortunately, we really just kind of planning it towards the beginning of April, and we weren't quite sure if we would be available to go in person. So we're going to do it again virtual. We try to do Housing 101 twice a year. We have been doing this since like 2015. So we're really getting good at it. We talk about fair housing, the property maintenance code, and then we have someone talk about the Landlord-Tenant Act. And those 2 speakers are from Legal Aid, and they are very knowledgeable, and it's pretty much a good time, like 4 hours free training. You can email us or give us a call and we can get you that information. The other training that we have is coming up on April 26th. That is through the our Tulsa Area Fair Housing Partnership. And that one is going to be focused a lot on just fair housing. We have a speaker from HUD. We have some speakers from the Greater Tulsa Area Realtors. And we also have a speaker from Legal Aid talking about fair housing. So let us know if you need that information as well. Do we have any? Nope. So far we don't have any questions. Felix,
Okay.
did you have something?
Yeah, I would like to add something. Okay, everyone, if you are planning to be part of or if you are part of the Landlord Gold Star program, it's very important that, whatever contact information you provide to them is the most updated, because the issue that we encounter is sometimes the email or cell phone that is provided to Kristin, we try to reach out to people, and then we find out we don't use it anymore. The phone is not working. So make sure that you put down contact information that we can reach you guys to. And again, communication is key, because anytime Kristin send me an email and be like, "Hey Felix, I got a new member. Can you reach out to them?" I'll try my best to reach out, in a timely manner. So I do understand that everybody's busy. I mean, so far it's crazy out there. I do understand that. So I allow you guys enough time to review our forms. If you have questions, you can email me, call me. I'm very, very flexible. But please, respond back. Let us know, because I have to let Kristin know, if you guys are enrolling or not, because you guys are receiving incentive from their part. So we have to give them an answer as well. So please make sure that we keep the communication up, and then that's pretty much it.
All right, thank you, Felix. We have a lot of incentives, including stickers like decals and magnets and posters and certificates and graphics that you can use to advertise that you are a participant in the program. And so whenever you get signed up, we'll get you that information. The inspections, we of course try to always do them on vacant properties. And I see that Casper Palmer is on the call. And so our inspections are a little bit different than the Section 8 inspections. Theirs are going to be way more rigorous, which is great. And but our public health inspections for the Safe and Healthy Homes program are focused on those big ideas, like we have a safe heat source, we have electricity, we have hot water, like there's no rodent infestation. So there's not really a failing of the inspection. If we see things, then you just say, all right, yeah, I'm sorry, our hot water tank went out, which things happen, right? And that you're going to get it fixed, because you wouldn't want to rent that to someone anyways, right, that didn't have any hot water. So I'm going to share my screen and get into the lead program. I didn't share it, did I? Or did I? Can you see my screen, Kristin? Oh.
Yes, we can share. We can see it.
Promise I've done this before. I don't know what's happening to me today. Well, I do know it's Monday, and also I'm on vacation for the rest of the week. So Felix talked about our mission statement and our values. I think that we are all getting a really good idea of what public health is as we all navigate through the pandemic together. You know, we're here to educate the public for sure. So the Lead Hazard Control Program is a HUD grant that we received in 2019, and we've been fully operational for like a year and a half now. We're going pretty good, and it's offered to rental properties and owner occupied properties in Tulsa County. So not just the city of Tulsa, anywhere in Tulsa County. And we do have a focus on 3 zip codes, but we can again do this program for anywhere in Tulsa County. And it's for single family homes or duplexes, of course, built before 1978, because that was the cutoff for lead paint. And we do want there to be children that either live or visit often in the home. So kids that are under the age of 6, we can come out and do a free lead inspection and risk assessment. And from what I understand, and you correct me if I'm wrong, Casper, but a part of the Section 8 requirements is that those houses have lead inspections. So, I mean, that's an option for you to give us a call so that we can schedule that lead inspection. And being a part of the Safe and Healthy Homes program, I mean, as long as I'm not inundated and just super busy with homes have elevated blood lead level children, we can come out and do those inspections for you. I have the same licensing that the other companies in town have. But we do those full inspections. We hire a contractor to remove those hazards once I identify them. And we're really rolling on this program. We've been going for quite a while. So we're focused on those kids that are age 6 and under, living in those houses built before 1970, and especially, you know, those older ones around the 1950s, because they're going to have more lead paint on the inside and outside of them than the ones towards the end of the 70s. Thank goodness. But we also help whenever we have an elevated blood lead level child, identify other sources. So sometimes it could be adults that are exposed to lead on the job or through their hobbies. It could be the kids are exposed to the dust on the parents' clothes whenever they come home from work. And we're also concerned about pregnant women and nursing women. So whenever we talk about kids under the age of 6, we're also including the pregnant women in on that definition. So lead can impact your child in many ways. And it is sort of a scary thing, but I try to educate the parents, and I feel like that's an important way to go. It's not like getting the flu. Being exposed to lead causes more of an acute change in like their nervous system. It could change their academic achievement over time. A lot of times these issues aren't realized until a child starts school. So it's really important to have children that are living in these homes tested early, blood lead level tests, so that they can be identified and they can give us a call. Here's a picture of a bean pot. This is something that can leach food out or lead out into the food. So this is one of the things that we look for whenever we're doing an inspection. It's not just lead-based paint. We're also concerned about utensils and food and things like that. I came across this picture during a training that I had last summer, and it really shocked me to see the difference in, you know, a child drawing a picture that has not been exposed to lead, and then one that is an elevated blood lead level child. So this is what we're talking about. You can see where a child that is that far delayed might not ever be able to catch up. It can really affect them for the rest of their life. Again, there's not just lead-based paint that we're concerned with. Whenever we have an elevated blood lead level child, we're also looking at toys and jewelry items. There are I mean, we're still finding these items in our stores. There's, you know, some loopholes where some of these items get through. And if you have like the little flip-flop keychain and you're sitting in traffic and you just sort of have it in your mouth, you could expose yourself to lead. Or if you give your keys to a small child to kind of distract them while you're at the doctor's office, instead of giving them your cell phone, they could put that in their mouth and be exposed to lead. And I mean, those are very, very high part per million amounts of lead that are in those items that can, you know, go directly into the child. And again, like the things that come out like at Halloween with the fake teeth going in the mouth and the orange paint on the fake teeth, I don't know if you can see that okay, is 65,000 parts per million lead. I mean, that is very serious. So we also want to be careful with the toys that we're buying our children as well. So lead hazards, again, they can be found in the toys or the jewelry items. It can be found in paint. We're not talking about little kids eating paint chips. We're really talking about the dust that can collect on the windowsills and the window troughs and the floors. And so as our small children are crawling through the house and putting things into their mouth, we're concerned about them ingesting the lead dust. We are concerned about lead being found in the soil around the home, in the play areas, and also the drip line. So whenever we come out to do a risk assessment, I will also take soil samples. We ship our samples off to a lab in Oklahoma City that runs those tests for us. We also take a look at if the family regularly eats things like imported candy or spices, or if they use those pottery items in their house. And then we can also refer you to the City of Tulsa for a lead test of your water, which is a really easy process. That's a great department to work with. So what can you do? I don't want to scare you guys, but again, I mentioned earlier, if you have tenants that live in a house that's built before 1978, or if you yourself live in a house built before 1978, your children should be tested for lead by their doctor before the age of 24 months. And if they are high and their blood lead level, it was 5 and now it's 3.5 deciliters or micrograms per deciliter, that information is sent to the state health department, and then they can give you a referral to talk to the Tulsa Health Department, and we can get you contacted and set you up with an inspection and an environmental evaluation and find the sources of the lead dust. Here's a really cool picture of the lead-based paint that we're talking about, the container that it came in. So for you as a property owner, a landlord, a property manager, this is what we can do. So for rental properties, or again, owner occupied, it is an income-based requirement for the lead grant work. Homes built before 1978, you have kids that live there or visit often, so it can also kind of capture an aunt or a grandma and grandpa's house if the kids are there really often, or like a babysitter, you know, living in Tulsa County. You can contact us. You can go to our website and enter in your information, and I will send you an application, and we can get the process started. So kind of how it works is I go out and I do an inspection. I give you a report, and I identify the hazards. I give you a scope of work and all the information that I need as far as income and bank statements and pay stubs. We evaluate and make sure that you qualify for the program. Once we get all that paperwork done, I send it to a list of contractors that are licensed by Oklahoma Department of Environmental Quality. And we do our bid process, and we pick a qualified contractor. And examples of work that can be done in homes. I have a home right now that's getting their door frames and like a new windowsill and a window seat all rebuilt inside the home. And then I just finished one last week that all new interior doors and interior door frames, their baseboards were all painted. And once the weather warms up, the exterior of their home will be painted. I have several others that are getting new windows. So if you have those old wooden sash windows in your home, it's really important that you have us come out and take a look, and we can do that inspection. And these homes are getting windows. So I have one house that's getting 21 new windows. Those are just energy efficient windows. That can do a lot for the value of a house. It can do a lot for controlling or helping with the energy cost savings. It goes towards improving the neighborhood. If we have houses that are getting new windows and new exterior paint, we're really investing this money from HUD back into our neighborhoods. So you can contact us. We just hired Mandy as our lead program supervisor. She was the person that was running our vector control program. So she is taking her lead class next week along with Felix, and we're getting them all trained up to do lead inspections with me, because basically I'm just too busy. I can't keep up with all of them. I need help. And you can contact us. Does anyone have any questions at all?
Don't see any questions so far. Well, something that I would like to add is, once again, participating in the Tulsa Health Department Safe and Healthy Homes program is one of the requirements of the Gold Star Landlord program. But as you can see, this program, like other requirements of Gold Star, comes with its own rewards and incentives. So if you are currently participating in Safe and Healthy Homes or interested in participating, I'd encourage you to also check out our webinar on Wednesday, March 30th at noon, where we will be talking about the other program requirements for Gold Star. Well, if there are no questions or comments, then we can go ahead and end early. This webinar has been recorded, and we will make it available for sharing, as well as posting it on the City of Tulsa's YouTube page. So thank you all for joining us today, and I hope that I will see you all on Wednesday. Have a nice day.